Hello, everyone, and welcome to the Canadian Electricity Association's Conversation Series. The Canadian Electricity Association is the voice of the electricity industry in Canada. My name is Dave McHenry, and I'm Senior Fellow with the Canadian Electricity Association, and I'm pleased to be your host for today's webinar. The Conversation Series features presentations from CEA's corporate partners, and the series will highlight a variety of Canadian and international solutions to current and future challenges faced by our industry. Working with CEA's corporate partners, these webinars have been developed to be of specific interest to those working in the electricity utility space from generation right through to customer. For a list of upcoming sessions, check out CEA's website at electricity.ca. These webinars allow a broad national audience to participate at low or no cost without the need to travel or invest a lot of time. We are broadcasting from Ottawa to over 60 locations across Canada and beyond today. Before we get started, there are just a few housekeeping items. Our session is scheduled to run from 1 p.m. until 2 p.m. Eastern Time. Questions can be asked, and we would encourage you to do so as they come to mind by typing them into the chat function on your screen, and we will be facilitating these questions at the end of our time. We'd ask that you please set your device to mute throughout the session, and a brief survey will be sent to webinar participants following the session today. We very much appreciate your candid feedback and are interested in any topics you would like to have included in the conversation series. Please keep an eye out for future webinars and events throughout CEA's monthly newsletter, Current Affairs. With over 6,000 subscribers, Current Affairs is very much like a national newspaper and is the place to go for Canadian industry news as we connect the national value chain from generation right through to customer. If you would like to receive Current Affairs, you can subscribe to this free publication by going to the CEA's website, electricity.ca, and simply putting your email in at that site. Today's topic is COVID recovery, getting employees back to work. Craig Sabine from Guidehouse will discuss how business and operational needs of utility organizations are shifting dynamically as a result of the ongoing COVID-19 pandemic. Utility decision makers are being forced to consider non-core operational and risk management factors to provide a safe and reliable service for customers and environment for employees. Recently, Guidehouse has been engaged by some of the largest organizations in the world to facilitate an accelerated, more safe return to work. For essential services providers, they will share the tools and approaches utility leaders across North America can leverage to get their teams back to work, maximizing productivity and establishing growth conditions as quickly as possible and as safely as possible, particularly for operations in field workforces and major project providers. I'd now like to introduce Craig, who's a director in the global energy practice at Guidehouse, where he leads the firm's utilities and energy companies segment in Canada and is past chair of Navigant's Regulatory Transformation Initiative. Craig, welcome to the CEA Conversation Series. I'll turn the webinar proceedings now over to you.
All right, thank you, David, and good afternoon and good morning to everyone. It's always a pleasure to be here with the CEA and the CEA members, and we really thank the CEA for the opportunity to engage with the sector here in Canada as our core clientele, as you know, in the country. It's exciting for me today. We're going to be talking about something a little different than you typically see me speaking to or helping to moderate with the CEA team, and delving into the current the current issues of our day here. I'll introduce the speakers shortly, and they'll provide you with a brief introduction to themselves. And of course, the materials that you'll have access to will have more on their bios and their expertise as well. The COVID-19 global pandemic that we are now in is very likely to be remembered in history as a seminal event, a moment that significantly changes the economic, cultural, and social course. This is not an alarmist statement, but an artifact of the constant change we endure in economic life, an identifiable disruptor. For many of us, no equivalent global phenomenon has been experienced, and as we shift the focus of intervention from mitigating the rate of spread to longer-term fundamentalism, Guidehouse has brought together and further integrated our key business segments to explore the challenge through lenses that are both practical and critical for clients. As an essential business, utilities and their supply chains, Guidehouse in this case, have been afforded an opportunity to better understand that phenomenon and support the strategic reintegration of a global workforce. As many of you know, Guidehouse is the recent outcome of a merger between Navigant, a commercial sectors focused advisory firm, and the former public sector consulting entity of PwC. Our cross-practice and multidisciplinary capabilities have evolved substantially as a result. Our health and life sciences segments partner with our other lines of businesses, such as energy and utilities, to bring deep insight and dynamic crisis recovery initiatives to evaluate business and operational needs, consider risk factors, and manage programs focused on getting people back to work and the economy restarted. The programs we observe are informed by leading clinical information and thought leadership, as well as regulatory procedural infrastructure and testing-based practices. We are excited to share some of what we have learned working with some of the world's largest global companies and national institutions on this problem and this challenge with the Canadian electricity sector today. And I'm personally excited to be able to do that and learn from our speakers. I'll leave the introduction there and turn it over to those speakers, who are David Berger, a director from Guidehouse Life Sciences, and Dr. Hassan Zawah, director in public health. I'll monitor the chat box for questions, and I'll help David to moderate the rest of the day today, and look forward to the questions that do come in, and please do send them in. I know there's going to be a lot of burning questions on your minds, and this presentation certainly incents a lot of interesting thinking. So away we go. Over to you, David Berger.
Thanks, Craig. As Craig mentioned, Guidehouse is the largest consulting firm in the world. It's a merger between the PwC legacy public sector and the Navigant commercial sector. We're the largest firm in the world that works equally in the public and commercial sector. We sit at the intersection between public health, disaster relief, recovery planning, and commercial markets, providing insight and guidance, consulting guidance to communities around the world. For us, although COVID-19 has been certainly impactful, our experts and advisors have been involved in public health crises before, including HIV, Ebola, H1N1, Zika, SARS, and MERS, including our significant experience in epidemiological program management. We work with a number of federal agencies within the United States, such as the FDA, CDC, but our presence truly is global, and we have helped a number of organizations throughout the world, in Europe and Canada and in the United States. I'm very proud to lead the Guidehouse's regulatory affairs, patient safety and quality division within our life sciences segment, and be one of the co-leaders on the COVID-19 team, which humbly is very humbling and includes medical doctors, PhDs in virology and immunology, such as Dr. Zawah, who's with us today, masters in public health, and one of our more recent team members who's recently joined Guidehouse, Donna Knudsen, a former deputy director of CDC. So as we start talking here about the challenges in front of us, what we've seen in Guidehouse is one very universal challenge, which is, how do I get the information that I need to distill it down into a simple, understandable way that I can process as a leader of my organization, and then transmit and communicate to our employees to make them feel as if they're returning to the workplace, which is a safer environment. And as you'll see in the slides, it really advances to a question, the fundamental problem set question here, which is, how do we ensure that if you can go to the next slide, please. The fundamental problem set really is, how do we ensure, one more, the fundamental question is right here. Here's the problem statement. How can utilities and other essential services provide a safer work environment for their employees and customers? I'm very proud to share with you today that Guidehouse's clients are all essential service providers, from the largest customers and from the largest companies in the world to school districts, including municipal utility authorities and large cities and towns. So the issue really here is, how can we do this for our employees so that it's demonstrable to them that we're actually creating a safer work environment? And what types of things can we do to inspire and create trust amongst the workforce? Well, why is that important? The reason that's so important is because at the end of this whole program, at the end of this pandemic, there will be an employee referendum, and companies that are perceived to have handled this well will have high rates of retention, and companies that are perceived by their employees to not have handled it well, that will see significant rates of attrition. So those are the questions that we need to start thinking about. So as we look to the next slide, the questions that management has to figure out is there is so much information that is available, so much information. I've heard it likened to not drinking from a fire hose, but rather drinking from a fire hydrant itself. The volume, the breadth, the intensity of the information is so overwhelming. How do we process that information? And what we've been able to do here is we've been able to establish this unique team that I mentioned before, with the goal of taking all of that information and condensing it down into digestible, understandable, simple chunks of information that can be processed, matched against your risk assessment as an organization, and then communicated to your employees. You've heard me mention communication a number of times. I'm doing that on purpose. The most important part of your plan is not just drafting the plan, it's communicating and training on the plan. You'll often hear leaders talk about the three most important things when engaging employees are communication, communication, communication. Never has it been truer than in this circumstance. And I'll give you an example. You can have the world's most beautifully drafted plan that covers every single contingency, but unless you communicate it to your employee base well, and unless they really undertake that endeavor with you, you won't get high adherence. You won't build high trust, which are the two very important things that you need to build to lower the risk and mitigate the risk of contagion. So as we go through, so next slide, please. What we've done here in Guidehouse is we've had this 360-degree view. The sphere is actually an excellent representation of how we've been involved in the current pandemic. We've been involved from the very beginning all the way through what we hope is the near future, which is deployment of vaccines and therapeutics. We've been involved in every phase of this program. We started our journey by helping companies solve the PPE crisis in the United States and worldwide by obtaining things called emergency use authorizations for masks, for hand sanitizers, for ventilators, for testing kits and other products. We've also helped companies withstand the severe economic impacts that many companies worldwide have felt through the pandemic and the contraction of gross domestic product and revenues. Another solution that Dr. Zhao will talk about later is sort of deploying out-of-the-box solutions for organizations that had never thought of things like testing or protocols or isolation rooms and the like. The nice thing that we've been able to do and impact public health more directly is we're working with two of the three leading vaccine developers in the world. So we have really great insight into what's coming down the pike, as well as working with one of the therapeutics candidates. So that's sort of the picture of what Guidehouse has done. But let's talk more specifically about what you all can do in the context of trying to entreat employees to come back to the workplace in an environment that they actually feel is safer. So by now, everyone knows the familiar refrain: wash your hands, 6 feet apart, social distance, and wear your mask. Those are what I would call the first and secondary level of precautions that you can take. But what we've found is that employers often feel overwhelmed with or don't necessarily have insight into those third and fourth level precautions that they can take. For example, if you're advising people to wear masks throughout the day, except in certain exceptions where they can take them off, I'll give you a great example. If you're sitting at a cubicle and the cubicles are socially distanced, and the company's rule is that you can take the mask off when you're sitting at a socially distanced cubicle, so long as nobody else is around you. Well, the first question that comes to mind is, well, what do you do with the mask? Do you put it on a hanger? Do you put it face down on your desk? If you're putting it face down on your desk with the inside, then you're sort of defeating the purpose of the essential nature of the mask. So, or do you put it in a brown paper bag so that it can air out but be protected from other potential aerosolizations and other airborne particles? So there's that third and fourth layer of protection, or the third and fourth layer of SOPs, standard operating procedures, or policies and protocols that most companies don't necessarily know to enact. And that's okay. This is a hopefully once in a lifetime event, and it's completely okay if your plans are not complete. It's okay if your plans are changing. The knowledge that we have about the virus is changing. But what we're trying to do here with this roadmap that you see in front of you are to map well-established criteria and categories and buckets of what you can do in your workplaces to create the most fulsome, comprehensive, thoughtful policies in a multi-layered approach that will help to keep you the risk of contagion as low as you possibly can. So we've divided it into 4 buckets: environmental and facility controls, HR policies, safe work practices, and medical monitoring and tracking. So let's dig into a little bit of that. So what do we mean by environmental and facility controls? Well, they're sort of what you would think they are. Ventilation. How is your ventilation system? What we know now, and what Guidehouse had known from very early on, is while large droplet may be a means of transmission, we also knew that aerosolization was a means of transmission as well. So the concept of air exchange becomes very, very important. Moving air in and out of surfaces and exchanging and changing air is super important. Physical barriers, we also know, are very important. Some of our clients we've seen that continue to have cube farms have added on to their walls and created very high wall partitions, almost acting as if they're sneeze guards. Spacing, everybody knows, and badge tracking and monitoring. Well, what about that? Well, one of the ways that you can eliminate human error in badge tracking and monitoring is to make sure that if you are going to be deploying a symptom tracker or even a testing framework in cooperation with the federal government or the local provinces in Canada, you can have the results potentially interfaced and interlaced with your HR systems, so that if there's an event of a positive test, it automatically locks out badge access, so you don't have to worry about someone actually uploading those policies. HR policies are also a key piece of importance. For many people, this experience is quite traumatic. It's very impactful. It leaves a lot of questions and a lot of uncertainty. So the way to assuage your employees' concerns is with that fulsome outreach through employee policies and HR policies, such as, do I have to take sick leave if I'm quarantining or isolating? Is there a possibility for me to manage my shifts slightly differently? Can I do shift swapping because I'm a single parent and my child's school district has decided to go virtual? What is the work from home policy? What are the expectations? Many of us are confronting quite a unique experience here working from home, where our days of office and home just simply blur. And then thirdly, what are the travel policies? Do I need to travel? Do I have the option to travel? And what's essential travel and what's not? Safe work practices are also something that you want to talk about very, very transparently. What are the expectations for wearing masks? Are the employees going to be bringing their own masks? Is the employer going to be providing the masks? What masks are okay? What masks are preferred? For example, there was a recent research study out of Duke University that found that obviously N95 and KN95s are some of the best at reducing aerosolizations and large particle expulsion, but things like neck gaiters were actually not only not effective, but actually acted as a microscreen in taking large droplets and converting them into aerosols. The next thing is hand sanitizers, making sure that they're plentiful. Trash bins. Well, as you're dealing with this virus and tissues and gloves and masks, what would normally be just regularly discarded, well, they may potentially contain biohazard material now, which requires potentially different handling regulations in your province or within the country. And then this can't be emphasized enough. Training on all of it. Tell your folks, how do they do this? How do they put the masks on? How do they take them off? What order? Another good example is, how often should they be cleaning their hands? Most of us, if you're like me, are regularly on your mobile devices, checking your messages, maybe even your private email, checking your Skype, and doing other things. Well, when you're in your office, what we do know is that cell phones can be a relatively good collection of different microbes and different germs. So do you want to encourage employees to regularly sanitize their phones as well? And then lastly, the medical monitoring and tracking, which Dr. Zhao will talk about in a little bit, about symptom awareness, symptom testing, symptom assessments, testing, and tracing. So let's dig in a little bit into each one of these.
Hey, David, maybe before we jump on, a question here that I think fits is that given that there's no parallel to this crisis in at least recent history, And we're learning so much as we go along. How can plans and procedures that have already been put in place by those who believe that they're out in front be adaptable and integrated into a programmatic approach that isn't too early and isn't too late?
That's a great question. And I'll direct you to the center circle of this chart, which is the response team, because that's the essential nature of the response team. Your job's not over once you deploy your policies and procedures. Part of that response team's obligation to their employee base is to keep continuous monitoring of what's evolving in the space, both from a legal perspective, from a statutory perspective or a code perspective, but also from a public health perspective and a science perspective. A great example is the notion of asymptomatic transmission. Very early on, the data indicated from China was that asymptomatic transmission was not as great a concern as we know it is today. And had your policies sort of just focused on temperature screening, it probably would have missed anywhere from 40 to 60% of the potential workers that could be infected. So, David, I think that the answer is it's never too late to change. And what you'll hear me say and what we've said in our articles that we've published out in the marketplace is it's okay if the plans need to evolve. It's okay if they're not necessarily complete and up to date. The most important part that you can do to engender the trust, which will drive adherence and therefore result in a lower contagion with your employees, is not to only tell them the what, but to communicate the why. Why is this changing? Is it changing because the science that we know today is better than the science that we knew yesterday? For instance, there's no way that we can intelligently talk about the long-term effects of this virus because by definition, long-term is longer than 12 months and the virus hasn't just left 12 months ago. So a great question. And the answer is the work is never done and it's never too late to improve upon the information. And that's actually one of the main services that we serve for our clients, which is being that eyes and ears and surveillance and being able to, again, look at the landscape, the massive landscape of information that's available and compress it down into easily digestible, easily implemented information that employers can share with their employee base and hopefully garner trust and adherence. So with that, let's take a look at what the first step is for any industry, whether you're in the utilities business, e-commerce, your public school, or if you're a retailer, or if you're in the home services or in the pharmaceutical space. It all starts with your risk assessment. You have to determine what your risk tolerance is. There are some clients with whom we've worked that have a very low risk tolerance and have been exceptionally conservative and have tried to maintain as little as possible in-person workers as they can. There are some that are more aggressive and some that actually just need as many as they can because of the nature of their business. For example, an electrical utility for workers on the line or manufacturing. And then you take a look at what the interventions that you can do. And you see what you need to have and what you'd like to have. And you implement the need to haves right away. And then it's all about executing. Time where you have to draw up the plans, but then you have to actually deliver the plans. You have to communicate to the employees what you're going to do, when you're going to do it, what the expectations are for the employees, what their role is in helping to play the part to reduce the risk of contagion in and mitigate the risk of exposure in the workplaces. One footnote here, what I would strongly recommend is no matter what your plan is, try to have it into one central location that is easily accessible, because in a time like this with heightened potential anxiety, it's not very helpful to have your plans and procedures in 4 or 5 different locations that the employees have to piece together. So we have created on the next slide, you'll see a roadmap on 5-step approach. And very quickly, the step 1 is to assess your start and your entry. Step 2, if we can go back for a second. Step 2 is to continuously monitor your regulatory environment. David, that's the question that we talked about before, not only your federal and provincial level, but also scientific. 3 is as you develop your strategy. 4 is you start drafting your plan. And then 5, you continuously monitor and you adjust. This is the after action post or the post hoc adjustments that you need to make on the fly. So we're going to, at this point, unpack each one of these steps a little bit. So in your assessment of requirements for restart and reentry, you have to take a look at what your baseline is. And you align what I mentioned before, what you'd like to do with what you need to do to get employees back to the workplace. What are the key points for you? What are the pressure points? What are the pain points? What are the watchouts for you? And what do you want to do? Do you want to do testing? Do you, in Canada, it's a slightly different scenario than it is in the United States. The United States has a very varied response to testing. Who's going to be doing occupational contact tracing versus non-occupational contact tracing? Are you going to be doing employee training on PPE? What infrastructure is the bare minimum? And what will make employees actually feel safer? And how do we communicate? As important as a deployment of an SOP is to mitigate risk, whether it's rules about bathrooms, rules about masks, rules about one-way travel in a hallway, developing a solid communication that establishes the cadence and the types of communications are very important. Well, what do you mean by that? It would be very wise to develop standard templates for things like an exposure event, when you're going to communicate, to whom you're going to communicate, how long will you let employees know that changes in SOPs are coming before you actually roll them out. So those are some of the ideas around step one. In step two, you're taking that to the next level. You're looking at what you've developed, your preferences given your risk assessment, and then you're mapping it and matching it against the changing environments at your federal, provincial, and local and customer levels. And you're analyzing what the key sources of risk are, the actions necessary to mitigate your risk, the environmental changes, and you're tracking the regulatory response. And here's what Guidehouse has been doing in this regard. What we've learned is it's not necessarily the city in which or the location in which the office or the work is being performed that measures the true contagion to the workforce, but rather the communities from which the employees are gathering that actually determine and create this amalgamated risk matrix. So you can imagine if half of your population in a given office is coming from a very high risk environment and the other half is coming from a very low risk environment, what is the true nature of the risk for that office? It may not be, let's say for instance it sits in Ottawa, it may not be what the risk level in Ottawa is, but rather those two cohorts of employees. So that's one of the things that we're doing through our software that we're developing. In step three, this is where you finalize your plan. And it's important to make sure that there are sufficient stakeholders at every level to not only communicate and adopt, but actually to practice this policy. You want to be taking constant feedback. You could be monitoring social media, for example. It's very difficult oftentimes to get a true measure of an organization's culture from a top-down perspective, but rather there are surveillance tools that you can use. Not surveillance, but rather regular social interaction and feedback. Social media is a great way to do that, to sort of understand how your employees are feeling about this. Are they anxious? Do they feel comfortable? It's all about building muscle memory. For example, one of the school districts with whom we're working, we talk about fire drills and active shooter drills. And the reason why they drill on that is so that when the crisis occurs, the reaction isn't one that requires a lot of thought. It's instinctive and reactionary. Same thing here. You want the SOPs, policies, and procedures that you develop to be reactionary, that don't require a lot of thought, that don't have a very wide margin for failure, and also will build comfort, confidence, trust, and again, adherence, which is essential to mitigating your risk. So here, for example, one of the options that we developed for a client, and Dr. Zhao will talk about it more specifically, was they decided that they wanted to build their own lab and test their own employees, and we helped them do that. We also helped the client to develop testing kits so that they could test their employees. So these are all the things that you need to do. You need to establish this committee, you need to establish this framework, but also be open to change because it will happen. And in step 4, that's when you actually deploy your SOPs, your standard operating procedures, your policies. You send them out, you communicate them often, provide training. This is essentially the world's largest change management process, something that management consultants know very well. So changing human behaviors is not easy, but by constantly communicating, by transparently communicating, and by having good exchanges with your employees, again, you will gain their trust, you will gain their confidence, which will dictate adherence and lower your overall risk. And with that, I'd like to turn the presentation over to Dr. Zawa to take you through step 5 and the testing portion of our presentation.
Hey, David,
So,
before
hello, everyone.
we transition to Dr. Zawa, another question here that came in, actually a combination of questions. So as you probably can appreciate, most Canadian jurisdictions are going to be beginning to enter the winter season, and when we tend to have more issues in the system due to weather and such, and you know, as an essential service, we already have procedures and things in place to get the field staff back to work. Is there, how do we get information at a fast enough pace about how best to adapt plans to provide for that need for emergency services and field services, juxtaposed against, you know, potentially an emergency in our own business?
Sure. I can give you a recent example. So I live in New Jersey, and we just had a tropical storm come through, which was vastly underestimated in its impact. We had a few tornadoes, and we lost power and internet for about a week. And the challenge there became communicating with the public, because once all the cell towers go down and once all the communication levels go down, how do you let people know when they're going to get their power back? How do you let them know when the food that they may have been accumulating because of the pandemic might or might not spoil, or folks that are unwell and septic, when they're going to be able to take a shower again or use their lavatories again? So you need to think in advance. It's not that different from mapping against other events, other catastrophic events or other disaster events, hurricanes, earthquakes, and the like. The difference here is one of the rate limiting factors is bringing in emergency crews from outside because of the high transmissibility of this virus. We know that this virus is up to 1/3 as transmissible as the measles. Initial estimates were that the R naught, or the transmission amongst people, was up to 5. So we know that it's a very highly transmissible virus, easy to catch. So that's going to change your dynamic. So one of the things that's important, particularly in the utilities industry, is to identify where you need that surge capacity from a human capital perspective, how you're going to do it, how you're going to bring those folks in, if they're going to be tested by the province, where they're going to stay, and how you're going to go out to homes. Another very effective mechanism that we've used for our clients is encouraging them to provide training videos, not just to the employees, but to produce videos to customers on what to expect. So for example, if they have a line worker show up at their home, whether it's for an efficiency rating or if they need some work done because the conduit pipe is ripped off of their home, or there's, God forbid, a worse situation with a tree or a downed utility pole, put out a video. Here's what you can expect. This is what our workers will look like. They will have a mask on. They'll call you first. Anything that you can do to assuage the population and plan in advance is highly recommended. But it is going to be an issue. We've seen it. We saw it firsthand here in New Jersey. But the amazing part about essential workers is they find a way to overcome no matter what the challenge. It's really quite inspiring.
Thank you, David. I guess that puts us over to you, Hassan.
Thank you very much. My name is Hassan Zawa, and I wish I was as lucky as David and the others to be able to turn the camera on. You would have seen a very casual look sitting at the beach somewhere on the eastern coast of the United States. I finally took my kids on a vacation, and we decided to do that. My name is Hassan Zawa. I'm a director at the public sector of Guidehouse. I work on the change management, value realization, and communication for the firm on big DoD and Department of Veterans Affairs contracts. And ever since the start of this pandemic, I've been working with my colleagues from the commercial sector on, return to workplace plans and standing up clinical laboratories for, one of the 2 largest Fortune 500 companies out here. My background is clinical laboratory, so I'm familiar with testing and regulatory requirements for, ordering the test, selecting the test, and reporting the results. I also have a PhD in molecular biology, which allows me to understand the test at a granular level and advise clients of where do we go from here. So some of the things that we've done in the past, and I want to tie off what David started here. This is not a one-stop approach. This is not a one-size-fits-all. This is a multi-layered approach to ensure that both the customer and their employees, that they're reaching a level of safety and security to allow them to return back to the workplace. I don't like the term return to work because I've been working for the past 6 months from home, but it's a return back to the workplace in a safe, organized fashion. And not only that, but enable both the client and the employees to deal with the changing platform and a changing landscape out here. So you may return to work on Monday, but you have a positive case on Wednesday. What do you do now? Do you shut back down? Do you shift to a different strategy? So some of the key activities that we've talked about for monitoring and planning here is to prepare a plan. As they say, I'm retired military. I spent 23 years in the United States Army, and plan has been drilled in my head. You've got to plan for every scenario, every situation. So when you hit the ground running and things change, you have a plan for what you're going to do at that point in time. Part of the planning here is understanding what is your mission, what is it that you're trying to accomplish, and how do you prepare a plan that meets both the regulatory requirements and your mission needs here. We've helped clients develop plans to ensure that their safe return to workplace is done in a very organized fashion to prioritize the individuals coming back to work, i.e. who needs to be in the office, who needs to be in this physical space. And it's no longer that, John or Jane are the two individuals that need to come back because, they're critical to the mission and need to be in the office space. So you got to take the employee mental health and employee needs into consideration too. Some people like myself, are ready to return to a normal workplace in an office building where I can see other people and interact with them. But I also have to balance, my kids being home and they're not returning to school at a normal pace anytime soon. So all these things need to be taken into consideration. You also need to consider how often will you update these plans? What are the upstream and downstream effects for the plans that you have? And when do you trigger certain operating procedures? When do we go to reduce operations or sending people home? And to tie all that together, next slide, please, you take all the information that you have here and try to condense that into, now I have data coming from employee self-reported signs and symptoms. I have data from, temperature checks or things that I have done as an employer to verify the information they're giving me. And I have a case I need to deal with. And that case is either somebody with signs and symptoms that warrant testing or somebody who is actually saying, I've been in contact with an individual who tested positive. Where do we go from here? So we have a client here in the United States that we're helping that has a Canadian footprint. So the things I'm going to talk to you today about is not just applicable in the United States. This client has a plant in Alberta, Canada, and we're helping them sorting through these issues too. So when it comes to testing, what our firm does, it relies on the expertise, the scientific expertise of the individuals that we have to, one, recommend the best testing platform to answer the needs for what you're trying to do here. Do you do a PCR polymerase chain reaction test? Do you do a quick antigen test? Do you do an antibody test? And selecting the right test is based on what question are you trying to answer? What are the parameters for that test, like sensitivity and specificity and things of that nature. And so most people think about testing. It's like, all right, I'm going to do testing, but they don't think about, you need a provider to order the test. You need a provider to notify the patient with the results. What are your human resources policies to deal with an individual that comes back positive? And what we help with is advise the clients on all of these things. What are the HIPAA privacy laws that you have to be mindful of? The limitation of the testing platforms that you pick, and a slew of things out there that, from an energy perspective or any client's perspective, you're focused on your mission, you're focused on your business, and these things are not part of your core mission. So that's what we help with here. We bring these things to bear. We talk about the different laws and regulations for the provinces and the places that people work at and where they live, and weave together a comprehensive plan of how do you do testing at that point in time. Next slide, please. So as you know, when it comes to testing, there's sample collection, there's waste disposal, there's sample transport, there's reporting, and the testing itself. So most people focus on that last diamond right there to talk about the testing itself, but forget all the other things. So if you were to say, hey, I'm big enough, like a huge company that we helped here, it says, I want to stand up my own lab. So we have expertise within the combined Guidehouse workforce here to say, we can help you with that. And what I really mean by that is the client came to us with a white sheet of paper and said, I want a turnkey operation. In 30 days, I want an operating licensed lab to do testing at my facility. We helped him draw the plans, hire the staff, write all the SOPs. We did not help him with selecting the test because they had a test in mind, but we helped with all the other things that needed. And we actually set a record for taking a lab from scratch, and literally from scratch. And we took a break room in their building and converted that into a biosafety level 2 facility, and obtained a Clinical Laboratory Improvement Act license, which is an equivalent state license or federal license to operate a lab with a high complexity testing. So we set up all the sample transport, reporting, waste disposal, and we help with employee hiring too. Next slide, please. So one might say, you know, I don't want to build my own lab. I want to, you know, do testing, but partner with somebody. So there's pros and cons to every approach out here. And in Canada, you have a unique situation there where the government is conducting, you know, 95 to 99% of the testing. But what we have seen over the past few weeks is private laboratories stepping up to the platform to say, I can help industry with industry testing. So we're no longer thinking about supporting hospitals or supporting, you know, doctors' offices, but we want to turn to industry and help the industry make sure that they are operating in a safe fashion and they have plans to execute that. We've identified multiple testing partners in Canada that we've had discussions with. We actually connected a testing partner with the client that we have in Canada to actually execute exactly what we're talking about here, industrial or commercial testing, to make sure that the client feels comfortable with bringing employees back into the workplace. You know, some of the cons to actually partnering with the laboratory, and specifically in Canada, that as the government becomes aware that these labs are out there and are performing testing on an industrial basis, and there's a shortage on the government side, they may tap into these laboratories to say, we will take priority. The NHS will take priority over any other testing out here, which may delay your samples. So what we can help do here is set up agreements with that lab to give you priorities, or to set a quota for testing for certain employers, to make sure that you don't get bumped to the bottom of the list or have, you know, a 2-week turnaround time, which makes the test almost obsolete at that point in time. Again, when you buy or build, what do you think of that? You need to keep these things in mind. What are your priorities? What is your budget? What are you trying to accomplish here? And what is your long-term plan? So the employer here in the States that we helped build the lab, their long-term plan is they will offer this testing for the foreseeable future. And the foreseeable future is 5 years from now for them. And they might start offering it to the public or help others with testing too. Next slide, please. So today we've summarized for you the capabilities of our firm, one of the largest firms globally that offers, you know, both management consulting and scientific experience at the same time. We've helped both state, local, federal, and commercial clients achieve the goals that they need, specifically in this COVID-19 crisis here. Now I'm going to turn it over to the moderator to see if you have any questions that we can answer for you.
Oh, great. Thank you very much, Hassan, and David and Craig. We've just had a real wash happening over us in terms of how to respond from a COVID perspective. I was noting things like, never really thought about it. What do you do with your mask when you take it off? David, you brought that to our attention. And your model about environmental and facility controls, HR policies, safe work practices, medical monitoring and tracking, and all coordinated through a centralized communications team, very effective. We also heard about standing up a testing center if we're looking to do that. If you're going to do it yourself, you're going to partner. Private lab testing. Wow, a lot of stuff going on there. So to our audience, we've got a few moments left. If you've got a question for our experts that we have on the screen, please feel free to pose your question in on your dashboard, and we'll look to get to that. But maybe just as we're waiting for people to come in on that front, we've got some other questions. One of the first questions is, despite how many PPE, personal protective equipment is used, or how many controls are in place, there is a risk of getting infected. This virus is not something that you can see or touch. I think companies should try to keep the people separated as much as they can minimize the risk of COVID-19 transmission. I don't know how companies decide it is safe to work from home, knowing that there are thousands of COVID-19 cases out there. Just might there be a comment related to that statement?
It's such an incredibly complicated scenario. I guess the best metaphor I can give you is think of the world's largest spider web, because when you pull on one part of the spider web, it reverberates and reacts to everything else. If you bring people back to work, you have school issues with needing childcare, and if childcare is closed, or if schools are closed, it's such a dynamic piece. And at the same time, we all need to afford groceries. We need to be able to make a living to be able to buy PPE or hand sanitizer and food for our families. So I think the most important thing that you need to do is you need to find yourself a trusted source of information. There is a lot of information that's out there. It's that drinking from the fire hydrant. Sometimes some of the water is stale. Sometimes some of the water is not really pure and potable. So you need to find a reliable source. You need to do some homework. That's, again, one of the functions that we fit in. And then you have to match it against your own company. The companies have to match it against their risk tolerance, and then individuals need to do what they need to do with that information. Now, in speaking with friends, I'll make it a very personal example. In speaking with friends, we have an option here in New Jersey to choose whether or not you want to send your child to school or if you want them to go virtual. And at the end of the day, my advice, they come to me and say, well, you know a lot about this. What's going on? What should I do? And the answer isn't what I would do. The answer is have information, make the best decision you can for your family. And when it's in a work environment, you're making the best decision you can for your work family, your employees, the people with whom you spend the most amount of time with besides your immediate family. So it's a function of risk. It's a function of information, getting good and accurate information, and understanding that, David, if I might, I'm going to take that question in a slightly different direction, which is this ever going to end? And the answer is our bodies are an amazing machine. And there have been a number of pathogens throughout the history of humankind that we've had to come in contact with for the first time and for the 1000th time. And what we do know is that adaptive, incredible machine will learn to handle this contagion. The scary thing about it is this is the first time that it's being seen now, and it's causing some very upsetting and troubling effects, whether it's massive inflammation, in some cases fatalities, but over time, this will probably become part of the normal disease lexicon, much like H1N1 became. And we're going to need to adapt. We're going to need to learn. No matter how conservative you are, you're not going to be able to shelter forever. There are economic impacts. There are mental impacts to that. Vaccines will help. Therapeutics will help. But I read a recent report from some of the leading epidemiologists in the United States that said, if everyone would mask, this is the United States where the contagions are considerably higher, if everyone would mask and social distance for about 6 weeks, we could theoretically get down to a transmission level of less than 1 new case per 100,000 in the entire United States, which would be incredible, which are the levels that we saw happen in Europe when they started opening things back up. So it's all about balancing risk. There is no panacea here.
Great, thank you very much. Again, if you've got a question, please feel free to put it into your question panel on the screen. Maybe we'll just go to the next one here. You'd mentioned things, David, like vaccines, and are we going to be able to resume status quo operations, business as usual as a utility, and if so, when? And is there a vaccination timeline, and will it matter? It is the reality that this, I suspect, could become a seasonal thing. What is our new way of life?
Sure. I think there are two parts to that answer. And I think that the best organizations in the world recognize that this is an opportunity to future-proof their organizations. And going back to what was status quo is probably not going to be the best environment for a number of reasons. We are all involved in the world's largest beta test for remote work. There was some organizational reluctance to do that, whether or not it would be successful, whether employees would be as efficient and as productive. I think the data is starting to come in. So I think that companies that evolve and move forward just from their employee base and listening will do quite well. Again, that employee referendum. From a disease state perspective, again, I have to be careful about what we say because we are working with some of the manufacturing, the vaccine manufacturers and therapeutics, but it would not be unreasonable in a best case scenario to anticipate some vaccine being approved by either an EU or Health Canada or FDA the EMA, Health Canada, or FDA, by late this year. The challenge is going to be two things. First of all, two of the vaccines are mRNA vaccines, which require extreme cold chain storage. Very different from what you and I are normally getting in flu shots, which can sit at room temperature for much longer periods of time. So that logistics is going to pose a problem, number one. And number two, the volume of what's going to be available is going to be challenging. In the United States, for example, there's a committee called ACIP that is talking about prioritization, and it would follow pretty much what you'd expect. Emergency responders, healthcare workers as a first priority, potentially vulnerable populations as a second, essential workers as a third, and then folks like me that don't fit into any category would be sort of one of the last priorities. But our best guess, and that's where it really is, it's an educated guess at this point, hints to a very massive ability to roll out the vaccines into some decent time in 2021. I'd say it wouldn't be unrealistic to think about a mid-year 2021 for it to be available en masse. That doesn't mean no one's going to get a shot before then. Therapeutics will come faster. There are a number of, whether it's convalescent plasma or antibody cocktails, those will come online faster. But again, there will be supply chain issues, and most of them are infused. So they require a hospital setting. It's not a pill that you can take like an antiviral for the flu, whether it's Tamiflu or others. These require infusion right now. So, and again, this is a coronavirus. What do we know about coronaviruses? It's what gives us all the common cold. So the chances of this, and so were SARS, and so were MERS. So we know that these things circulate. So it's very, very possible that it will be part of our normal disease palette, if you will. But again, as our bodies adapt and learn, the risk of the severe reactions, the cytokine storms, which people are reading about, they start to get lower and lower. The interventions get better and better, right? Early on, everybody was intubate, intubate, intubate. And now we're learning maybe that's not the best thing. Maybe we do things like proning, turning people on their bellies. Recently, there's been an advent of dexamethasone as an anti-inflammatory. People were very reluctant in the beginning days to use steroids because it lowers your immune response. And you're also seeing incredible research coming out at an incredible pace. A recent study was looking at interferon beta out of the UK. So I think that as you see these things evolve, and as the world has just wrapped its arms around this massive amount of data that's being produced on a daily basis, look at it, find legitimate sources of data, look at it, monitor it, track it, but be prepared that it's going to be a while. It's not going to, unfortunately, disappear one day, most likely.
Great. Well, thank you. It's much more complex. Craig, what comments do you have?
Well, I was going to comment that increased refrigeration load for mass vaccination storage could be a good thing for our industry, perhaps, or maybe a big challenge, not sure. But a question here that we have is with regards to privacy versus safety. And I assume they're talking about potential for testing and things related to testing and what that means for privacy, and if that's been a concern that you've seen.
Most of the testing protocols and programs that we have worked with companies have been opt-in. So they're not mandated. In the United States, for example, there are a very limited number of things that you can require. For instance, employers can require temperature screenings. They can, in some cases, require testing, but they differentiate what type of testing. Antibody testing, for example, which looks about after your infection, is not allowed to be required. But most folks that are doing testing protocols or symptom checking, I mean, let's be very frank, if you're going to ask a bunch of employees what symptoms they're having, that's private health information. So, making sure that you're handling that in the right way is important. But again, most employers that we advise an opt-in situation. Again, go back to employee trust, go back to employee adherence, and the effectiveness of lowering contagion risk. If your employees don't buy in, and they don't trust you, you're not going to have an effective mechanism to lower your risk.
Mm-hmm.
Mm-hmm. Thank you.
If I may add one thing real quick, governments are, handling the situation pretty rapidly too. The balance between privacy and public safety is a tough one to measure here. There are ways to report infections, and there's ways to alert others to being exposed to an individual who's been infected without violating that individual's privacy. So I think that's the balance that we have to always look at from an employer perspective, but also comply with the laws and regulations as set by federal agencies and local governments.
Great, thank you, Hassan. Craig, do we have another question?
We do. Related to, and I think you've touched on this already about, how long is this thing going to persist? And there was some answer in there that said, in some ways, it may never go away. So on the same side, the massive changes that we are sort of undertaking in the business world and in our personal lives as well, do you see those practices remaining as well for a long period of time or forever as just good practice in personal safety and health and public safety?
I think so, and I'll give an example. The countries that seem to have had the ability to respond most effectively and efficiently very quickly are ones that had experienced severe outbreaks before. So, if you look at a number of countries in Asia that dealt with SARS, many of them had very lasting impacts. That disease had a very lasting impact in that region. And they required a number of changes, whether it was in infrastructure, communications, emergency response planning, public health agencies. So a lot of the stuff that you've seen come out of, whether it's Singapore or it's coming out of Australia or New Zealand or Hong Kong, a lot of it is basically having to suffer what we're suffering now in North America, that we've never suffered at that scale before in over 100 years. So I do think that a lot of that will happen. I joke with Hassan often, if people ever shake hands again. It'll be very interesting to see. In the North America, we're not a culture that masks when we travel. That's something that we see from our colleagues in other parts of the world. Will we become that? Will more people from North America become accustomed to using a mask on an airplane or as they travel through transit hubs? I don't know. I think that you will see definite evolution. I think that there'll be a number of evolutionary attacks. I think companies will start looking at their footprints, their bases, their cost structures, and find ways to again future-proof against this happening again. If you look over the course of history, by the way, the time gaps in between these public health crises are getting smaller and smaller. Maybe not on the scale that we're quite seeing today, but if you trace back from H1N1 and SARS and MERS and Zika, if you look at that scale, the intervals in between them, they're getting smaller. So, as humans continue to expand into regions where, animal diseases or zoonotic diseases were isolated, now they're coming into contact with humankind. And given how mobile we are as a society, it's not unlikely. I mean, if you look at Dr. Osterholm out of Minnesota or other public health experts, they've been kind of pointing to this for some time.
Well, thank you very much. It is obviously a very complex topic, and I know we're coming to the top of the hour here, so we're going to have to conclude at this point. So with that, would certainly like to thank each of you, specifically Craig, David, and Hassan, for joining us today. It's been very informative, and thank you very much to Guidehouse for sharing your expertise. And the presentation will be available for folks who want to contact further. So with that, I'm going to ask our listeners to simply mark your calendars, please. Our next conversation series webinars will be held on August the 27th. S&C Electric will speak to developments, experience, and best practice from performance-based regulation. On September the 8th, Opus One will speak to how non-wires alternatives help Nova Scotia Power weather the worst of Hurricane Dorian. You won't want to miss those. If you haven't registered yet, you can do so by going to CEA's website, electricity.ca, or you can reach out to Danielle Vezina, who can be reached at vezina@electricity.ca. So in closing, I'd like to once again thank Craig, David, and Hassan. Maybe just would ask that you each stay on the line after we hang up. And thank you for joining us today. And this concludes the conversation webinar for today, and we'll talk to you next time. Bye for now.
Thank you.
Thank you all. Bye-bye.